Good morning, everyone, and thank you for joining us today for today's webinar on what a federal coverage gap fix would mean for Tennessee. I am Kanika Young. I'm the Senior Director of Health Policy and Advocacy at the Tennessee Justice Center, and I'm joined today by Ella Matthews. Ella, would you like to introduce yourself?
Sure. Hey, everyone. I'm Ella Matthews. I work for Congressman Jim Cooper. We represent Nashville plus Davidson, Dixon counties. I'm Jim's senior health legislative assistant, and I handle all of his health policies. So glad to be here with you guys and talk about what the federal government can do to help get Medicaid expanded in Tennessee.
Thank you so much. Before Ella talks about that, we'll give an overview of what's happened so far on this issue. And I just want to let everyone know that the webinar is being recorded, and we'll also share a copy of the slides to everyone who registered tomorrow. We should be broadcasting on Facebook Live as well. So if you are watching us on Facebook, feel free to interact in the chat and share comments, and my colleague will monitor that and let us know if there are any questions there. For those who have joined us on Zoom, if you have a question, please enter it in the Q&A box rather than the chat box. It's a little easier for us to monitor the questions that way, and we'll try to save time at the end to answer any questions that come up. So be on the lookout for some upcoming events. We'll talk a little bit about them later, but we have a back to school vaccine info session coming up next Thursday. We also have a training about the PAE or pre-admission evaluation for choices on August 11th. And then on August 12th, we'll talk about WIC 101. And then on the 26th, we'll talk about household and income counting. And that'll be a workshop for people who deal with that issue more in detail. So for now, we'll jump in with today's webinar. And also want to note that for closed captioning, if you would like to turn that off, there is an option at the bottom of your screen. If the live transcript is distracting to you, you can turn that feature off on your end. So with that, we will go ahead and jump in. So what is the status of Medicaid expansion? First off, nationally, we have the Affordable Care Act is the vehicle for Medicaid expansion. For those who are familiar, that shouldn't be a surprise to you. The ACA became law in 2010, and the federal funding for Medicaid expansion became available in 2014. In 2012, the Supreme Court ruled that Medicaid expansion is optional to states, and that created the coverage gap. The coverage gap essentially means that there are individuals and families with incomes at or below 138% of the federal poverty line, which is about $17,000 a year for a single person. Those are people who also don't qualify for premium assistance on the marketplace. When it was initially set up, it was intended that everyone would expand Medicaid and up to 138%. And so the tax credits only started at 138%. So these people couldn't get coverage on the marketplace, and they also don't fit within the traditional Medicaid eligibility categories, which typically are parents, children, older adults, people with disabilities, women with breast or cervical cancer, et cetera. So we're talking about mostly working adults who don't have children who are in the coverage gap. And we'll get a little more detail about who those people are in a second. But under the Affordable Care Act, 100% funding was available from the federal government for the first 2 years of implementation of Medicaid expansion. And that amount gradually declined over the next 5 years, and it now sits at 90%. So the federal government pays 90% of the cost to provide coverage to these people, and the state would kick in 10%. To date, 38 states plus Washington, D.C. have expanded. And as this map shows, there are 12 states that have not adopted Medicaid expansion. 8 of those 12 states, including Tennessee, are in the South. And that's notable because the South is also home to almost 60% of the entire population of Black people in the United States. And while people of color comprise 41% of the entire adult non-elderly population in non-expansion states, they made up 60% of people in the coverage gap, and that includes 28% who are Latino and 28% who are Black. So Medicaid expansion is an issue that has racial implications. We also know that there are proven benefits of expansion. States that have expanded have seen increased healthcare coverage, reduced uncompensated care costs for hospitals, boosted access to care. They have better long-term health outcomes, and there's a positive correlation between expansion and improvements in mortality rates, coverage rates for people with cancer, chronic illnesses, and disabilities, and greater access to care for people with substance use disorder and mental illnesses. There have been two studies by KFF, the Kaiser Family Foundation, of literature reviews, and there's now 601 studies proving the positive results of Medicaid expansion. So this is really not up for debate as to whether this is good policy. It's been proven to be good policy. So what does the coverage gap look like in Tennessee? This data is based on a report that was published in June of this year by the Center on Budget and Policy Priorities. And it shows that there are 119 adults in Tennessee who are in the coverage gap. That breaks down to 28,000 essential workers. Those are people who are working those frontline jobs that continued during the pandemic. They include 11,000 parents who have children at home, 31,000 women who are at reproductive age. And this is significant because of the maternal health crises that our country is dealing with really high rates of maternal mortality and comorbidity as compared to other industrialized countries. So having access to health coverage before conception, during pregnancy, and after pregnancy is really important for women at reproductive age. The coverage gap also is comprised of 69,000 men and 50,000 women. In terms of adults with disabilities, there are 27,000 adults with disabilities in the coverage gap. And these are people who have disabilities, but they don't necessarily meet the strict standards for our SSI or SSDI programs in order to qualify for Medicaid. And then in terms of the racial breakdown, we see that 31,000 of the 119,000 people in Tennessee who are in the coverage gap are Black, 5,000 are Latino, and 3,000 are other races other than white. The majority of the people in the coverage gap in Tennessee at 79,000 are white. So after the Affordable Care Act allowed Medicaid expansion and the Supreme Court ruled that it was optional for states, we saw several holdout states decide not to expand. And we as advocates joined together across the southern states and joined in a coalition called Southerners for Medicaid Expansion. And one of our first priorities was to elevate this issue of our states really not listening to the will of the people. And we were calling on the federal government to step in and help us out. So the first thing that the federal government did under the Biden administration was to include a incentive for Medicaid expansion in the American Rescue Plan Act, or ARPA. This was one of the COVID relief packages that was passed and enacted in March of this year. It contains many provisions that are meant to combat the health and economic effects of the COVID-19 pandemic, but it includes a 5 percentage point bump to federal matching rate in traditional Medicaid programs for 2 years, as long as the state expands. So that additional federal funding for the traditional Medicaid program translates to almost $1.3 billion in additional federal funding for 2 years if Tennessee expands. Even after paying the state's 10% share of the cost of expansion, which that additional funding would definitely cover for several years, the state budget would still net $900 million over the cost of expansion for that 2-year period. Although, unfortunately, in spite of this new incentive, none of the 12 holdout states have passed Medicaid expansion yet, but some are making more progress. That's not been the case in Tennessee. We have not really made a lot of progress towards Medicaid expansion, and that's due to several factors. But to give you a sense of, how we got here, we'll kind of give a little history lesson. First, when the Affordable Care Act was made available in terms of Medicaid expansion funding, then Governor Haslam introduced the Insure Tennessee plan. This was a form of Medicaid expansion, and the then Governor Haslam had negotiated with Tennessee hospitals to cover the state's 10% share. That was rejected by our state legislators. Um, it's noteworthy that legislators are the decision makers on this issue because first, the power for the governor to expand on his own was taken away by statute that was passed by the legislature known as the Durham's Law. This essentially says that the legislature has to make the decision to expand and the governor can't do it on his own. Another wrinkle in terms of getting Medicaid expansion is that a ballot initiative is not possible. We have seen that be effective in other states, most notably Missouri recently won a lawsuit to listen to the will of the people who overwhelmingly were in favor of Medicaid expansion. We don't have that option here in Tennessee because our Constitution doesn't allow for ballot initiatives unless they are proposed by the legislature.
And
So
Kanika, I was going to add one other fun fact there. Actually, 5 states passed Medicaid expansion through ballot measure under the Trump administration. So states and people want this done. And even, 5 states in the past 4 years is amazing.
that is amazing. Thank you so much, Ella, for pointing that out. So I think if we did have the option to do a ballot initiative, that would be a no-brainer for Tennesseans, as indicated by the fact that so many Republican-led states have chosen to do it. But again, we are in a situation, we're at the mercy of our legislature to make this happen. And unfortunately, Tennessee's legislature and Governor Lee have ignored calls for expansion from not only Tennesseans in the coverage gap, but also healthcare industry experts, hospitals, healthcare providers, and many patient and consumer advocate groups. And the rationale for denying expansion and rejecting it has really evolved over time. First, they said, oh, there are lawsuits pending to do away with the ACA, so we don't want to go down that road and then have the law be repealed. That didn't happen. The ACA has survived many legal attacks. It's still in place and it's still available for states to expand. The next sort of excuse that they came up with was that there was a fear that the federal government might pull back the money and not provide the 90% match. There's no indication of that happening. The 90% match is in place permanently, and it's something that states can rely on as they expand their programs. The next excuse was under the Trump administration, there were various attempts to really undermine the ACA and even attempts at the congressional level to repeal the ACA by legislative action. Those attempts failed. The ACA survived again. They've survived the executive, the legislative, and the judicial attacks on that law. So that can no longer be our state's reason for not expanding. So then the next excuse that they went to is the block grant. Tennessee is the first and only state to propose this really experimental program of capping their traditional Medicaid program. That's the Medicaid that 1.5 million Tennesseans rely on today already, that provides healthcare coverage to those parents, children, older adults, people with disabilities, et cetera. The state has decided that instead of the normal matching rate where the federal government pays about 65% of the cost of the program and Tennessee pays about 35%, we would instead get an aggregate cap of the federal funding, and Tennessee would have the flexibilities to manage the program and change certain provisions as it relates to administering the program in order to save money and to draw down and have more money to invest. This block grant proposal is the subject of ongoing litigation. It really is a distraction from Medicaid expansion. It is really not about getting more money to invest in our healthcare infrastructure, because if it was about having investments, the easiest way to get that funding to make investments and improve our system would be to expand Medicaid. So, in response to the ARPA incentive, there was a bright spot when Lieutenant Governor McNally stated that he thought that the legislature should take a very serious look at it and see what the federal government was offering. And he was optimistic that most legislators would be willing to take a look in light of the ARPA incentive. But we saw that play out, and the ARPA incentive really didn't change people's minds. House Speaker Cameron Sexton, Governor Lee, and other leaders in the Republican Party dismissed the notion without even considering it. And this is all despite the rising uninsured rates in our state, the declining health outcomes, the increasing financial burdens, and we're still in a global pandemic. So now I'll turn it over to Ella to talk about what the federal coverage gap fix looks like, what it would possibly do, and some key considerations. So Ella?
Hey, so here we've come into a new spot where 10 or so years out of, the offer of Medicaid expansion, and we have these 12 holdout states with the Biden administration taking over and our slim majorities in the House and Senate. We've made this a top priority, and we're looking for a solution. There's a lot of urgency to address the coverage gap, and get these states to where they need to be and fulfill what the ACA was supposed to do, and get these 2.2 million people coverage that they need. So there are a couple different options to do this that we're looking at, and it would likely be in a budget reconciliation deal, which would, if possible, because you don't need any Republican support on that, we'd be able to pass it through the Senate, which, as a reminder, I think this is always interesting to think about. There are only 3 Democratic senators that are in non-expansion states. So it's really hard to get buy-in in the Senate because most of their states have done the right thing and expanded, or the Republicans in their states don't want to do it. And especially now that we've offered them the ARPA incentive and they've still chosen not to do it, at least not publicly, we're looking at every option. So one of the 2 options is just to create a new federally run Medicaid program for these 12 states that haven't expanded. We would kind of tailor this new option, and the federal government would take up the whole tab and just run a full, instead of having the federal state program that's run, it would be fully federal, and they would offer that to those 12 states, and they would tailor it to kind of fit that smaller population. The other option is to remove that bottom level cutoff, the minimum cutoff that Kanika mentioned on the marketplace, the ACA healthcare.gov marketplace, and allow those people to come on who are in that coverage gap to then enroll in the marketplace. Now, the problem is the way the marketplace works is those plans are nothing like what you're offered in a Medicaid plan. First of all, there's, deductibles, there's higher cost sharing, pay premiums, all of those would have to be removed. And then you have questions about who's allowed to enroll. And you also have to build out these huge programs. So what does that look like? Who are the providers? What benefits are offered? It'd be difficult and pretty hard. But Congress is taking a look at this, and we proposed a couple bills that are then just a fun note. Jim is a co-sponsor of both, anything we can get done on Medicaid expansion. So one of them is the Medicaid Saves Lives Act. It was introduced by Senator Warnock, one of the 3 senators that's in a non-expansion state. And that would be this new federal Medicaid lookalike program. So unlike when you enroll on the ACA and you only get 1 time a year to enroll unless you have a determining life event or a big change, you would be able to enroll continuously, which is something that you have in Medicaid, where it's based off your monthly income and you're allowed to enroll throughout the year, not just once a year based off your annual salary, because that's not really what fits the Medicaid population. It would also have benefits that aren't offered in a traditional, like public option or a private plan. And that would be that you would have transportation benefits for non-emergency measures. You'd have substance abuse and mental health benefits, preventative services, maternal care, prescription drugs would be included. along with the essential health benefits and hospitalizations, and those things would all be covered. And they would also be done, without premiums and without deductibles and with really low cost sharing to look exactly like the Medicaid program. Now, and the part of this that is hard is that the federal government is about to pick up the whole tab for all of these bad actor states that have not chosen to expand. So there's a little bit of an issue because you have all these states that did the right thing and they're like, we put in all the money. Why are you just going to pay for all the people who didn't do what they were supposed to do? So in order to do that and kind of address those issues, we're going to continue to keep encouraging states to expand. And that's going to be a big hurdle for us to get through, but they will, as Kanika described, that match that you get, they're going to bump it up to 95, make it more like what was offered during the ACA, plus what we have with the American Rescue Plan, ARPA. And so states would continually be encouraged, and then those people would leave this new federal Medicaid plan and move on to their new state Medicaid expansion plan, which is what we need, because as we described, the ACA is the law of the land, and the way that it works is if every state expands. So that's our goal. The other option is for the Cover Now Act, which was introduced by Lloyd Doggett from Texas. Jim's also co-sponsor of the bill. This is kind of unlike anything else. It would allow counties and cities and smaller jurisdictions to apply for Medicaid expansion without their states. They could completely circumvent the state, go directly to the federal government and expand within their own populations. Now, this is very hard to do. The federal government's even struggling with how to figure out how to create their own federal Medicaid plan. Imagine a county being able to create these programs, enroll these people. And also there's a huge equity issue. The states, there are the counties that can't afford it and are able to build up these programs. That's not everywhere, and you're not going to have everybody. So you're going to leave a lot of people in these non-expansion states that don't get coverage. So we don't want to let perfect be the enemy of the good, but at the same time, these people are getting coverage that who wouldn't have it. And for example, if you did it in Shelby and Davidson counties in Nashville, you'd cover more than 50% of the coverage gap in Tennessee. So we could get a lot of people coverage. It isn't perfect though, but it's better than nothing and where we are now. It also probably might have a little bit of a challenge in the Senate, but we're working through all these options and they're all there. So as I mentioned, how to get holdout states to expand. All of these options have increased incentives and would not in any way preempt states from moving forward with expansion. In the Cover Now Act, it would actually penalize states that tried to obstruct their counties from doing this Medicaid expansion. And there are some issues with that, but being able to, freely let them do that and work with the federal government, regardless of what their state thinks, because these counties are willing to make it happen. And as I said, in the Medicaid Saves Lives Act, they're increasing and expanding the incentives for those states to expand to encourage them to get to expansion. And the other part of this is how to keep states that have done the right things, these expansion states, on board. That is going to be tough. It's really hard to reconcile what that looks like. Paying for them to have fully federal Medicaid versus doing what they were supposed to do and have the states cover that 10% or 5% is an expensive and hard challenge to have. And it'll be interesting to see what that looks like, but we can move forward if you'd like, Kanika.
Thanks, Ella. That was really great. Can you speak at all to what's the timing of any of these acts?
Yeah, that's a great question. So what we're looking at now is they're currently voting on an infrastructure bill, but there's also going to be budget reconciliation, which is kind of a bigger plan where we can create a deal. It has to have federal cost implications and it can be passed without any Republican support. So if we can get all the Democrats on board, we can do this. It's looking like what we're going to do is one of those two options, a federal Medicaid program, which is huge. And there's a lot to think about there and build it. And they're working through those details now, but that will need to be done by the end of the year. So the timeline for this is pretty quick and we have to do it now before we get to the 2022 midterms, because that's when we have the control to be able to move this in reconciliation. I've spoken with them. They're really grinding out these details of, what do these networks look like? Who are the providers involved? Is it easier to do it on the exchange or is it easier just to build up a new program? Because that takes a lot of logistics and administrative infrastructure that we're going to have to build up and have people to want to get involved. And if you move to a fully federal Medicaid program, that's on the marketplace, that doesn't look like what the insurers on the marketplace are used to. and it would involve everyone. Anybody could get onto this public option. It might not just be for the 12 states, it could be for everyone to come in and join this public option and have an alternative. Which you could move people out of their own state plans, which makes it harder for states to do what they're doing. You could also have the targeted Medicaid program, but that's 12 states that you're looking at, and it's such a niche population on what that looks like. So there are a lot of details still to be figured out, but by budget reconciliation this year is the goal of where this would happen.
Thank
Any
you.
more?
Let's see, let me just check in on questions. I see that there's one question about can we make an amendment to our state constitution? How difficult would that be? Unfortunately, that would be even more difficult than trying to do a ballot initiative. That still would require legislative action to put the constitutional amendment before the body and then put it on the ballot for the voters. So it's really, we're really in a situation where the legislature has the power. We're really at their mercy. And so the only way that we can make it happen is to convince the legislature to do it in our state.
And there's definitely a physical argument to do that. The American Rescue Plan, that amount that we were looking at, that $1.3 billion, which is huge, and they would never turn that down for anything else except for this, I swear, is that would allow them to not only pay for the amount of the program to cover these additional people, but they would have that $900 million afterwards that would allow them to pay for the program 5 years over, or they could spend it however they want. Think about it, it's only 300. I know that sounds like a lot of money, $360 million, but you are fixing a huge population of currently uninsured people who have no access to care. So the money is there. It's a huge amount of money, and we're willing to give them whatever it takes to get there. But remind them that they're not being asked to do anything except new money, and it's not precluding them from continuing their block grant. Though that is a whole conversation of its own. They have choices here. They can do both.
Yes, I think that's an important point. And also the fact that of the 38 states plus DC that have expanded, nobody's regretting it. Even though we are in a pandemic, everyone is falling on hard times, the tax revenues are down, et cetera, but there's no state that's saying, oh, I wish we hadn't expanded Medicaid.
And yeah, I was going to say, in fact, most states that have expanded have showed better state budgets outcomes from expanding, because you have less uncompensated care costs, where you have people, who are coming in with worse, situations. It's harder to find a job if you don't have any health coverage. You're paying for other things. You have more debt. It actually makes your society healthier, and then lowers your costs as a state, helping to pay your hospitals for all the care they're giving for all the people who are uninsured. So there are a lot of benefits, and no states have regretted that I've heard from.
Right. I see we have another question about the numbers of Tennesseans in the coverage gap. There's a study noted from CBPP that listed 361,000 newly eligible for Medicaid if Tennessee expanded. I believe that a lot of this depends on the methodology. So sometimes when you're talking about who would benefit if the state expanded, they're looking at the welcome mat effect. So they're estimating people who already qualify for Medicaid, who would then learn about the program and then see that they are eligible and enroll in that program. You're also considering people who would then benefit from the marketplace plans. So it's not strictly just who would be in the expansion population. It's sort of like what's the universe of people who are uninsured, who would find their way to insurance because of the state expanding and kind of raising the profile of the availability of this program. And sometimes it's also a function of timing and how the researcher is crunching the numbers. So the numbers vary, but the main takeaway is thousands of people would benefit in our state if we expanded.
Yeah, hundreds of thousands of people. And on the other side of that, you also have to keep the pandemic in mind. You had so many people who, because of some restrictions that Congress put in, people have to stay on, and you've had more people who've been seeking the benefits and needed more care. But the uninsured levels, that's pretty reflective of what they were pre-pandemic, and it'll be interesting to see where we are. I think this number is constantly changing, but yeah, hundreds of thousands of people.
I see we have a couple of other questions. One is, are you able to talk about some of the housing benefits that can result from expansion, particularly given the large amount of media attention lately in Davidson County about people living outside and in encampments? Ella, I don't know if you want to speak to that.
I don't have many additions to that. More that, I mean, they would still be able to enroll and seek care, housed or unhoused. And they also would then have lower cost. I mean, they'd still be able to get coverage for things and probably bring them into more fiscal stability with their own incomes. Medicaid programs, the reason that you want all of this to go through the states and, not the federal government is because states have a lot of abilities to, create certain benefits within their Medicaid program to kind of grow what that looks like for people. For example, something that's offered in Medicaid that's not offered other places, like I mentioned, was transportation. To be able to get places, that's very specific to the Medicaid population. It could, they could include other, I guess, benefits like housing or any sort of other assistance. And it also works well within the system as you're accessing your benefits and things you're eligible for to have all these people qualify at the same level.
Yeah, and I would just add that the additional funding that the state would get for healthcare would also shore up the budget in other ways. So the money that the state is currently, spending on issues of people who are facing homelessness, they would have more money to invest in programs to assist people to find affordable housing and to help them to address some of those issues that may be contributing to their situations, such as mental health issues or substance use disorders. So additional funding through this program would really touch on a lot of different areas that impact health. All things that are related to your health can be improved from Medicaid expansion because of the additional investment in the programs that we know help keep people healthy.
As well as some of the root causes that you were mentioning, the mental health and substance, a whole breadth of things. People in Medicaid expansion states are much more likely to have higher levels of medical debt. I want to say the WPLN did a great story the other day. It's people in the South have like an average of $550 of medical debt. That's 3 times higher than it is in the Northeast, and it's these non-expansion states. So that could put you in between the brink of being able to pay your mortgage or pay your rent, and then you become unhoused because you had to go and have emergency surgery and you had no way to pay for it, and you're making the choice, and that creates that cycle. So lowering that personal debt for people too.
Absolutely, great point. We'll get to a couple of more questions as we go through, but I wanted to advance and talk about the outlook. So if federal action is successful, let's say one of these acts actually passes and is implemented, what would happen in Tennessee? First off, we know Tennesseans in the coverage gap would get access to health insurance. That's the goal, and that's what we hope will happen. But another thing to note is uncompensated care costs would decline and hospitals that are currently struggling could benefit. Tennessee actually has the highest rate per capita of rural hospital closures. I think there have been 16 hospitals that have closed since 2010. And that would really, we'd be able to address that issue if we expanded. It's been proven that states that have expanded are 6 times less likely to lose a hospital because those uncompensated care costs can really make or break hospitals that are struggling, especially those that are in rural areas that don't have a really large population of private insurance patients that are coming to offset some of the costs in the services they're providing either at cost or for no compensation to the resident. So that's something that is a huge benefit.
And something we like to remind people is like a hospital is a town. You can't have a town without any access to healthcare. And I remember before the pandemic, or as we were, the first cases were coming, I looked at a map of Tennessee to see, if somebody got sick, where would they go? And most counties don't even have an ER, just a standalone ER, let alone a hospital there. So people are, especially we've seen over these past 10 years, as we mentioned, highest per capita hospital closures, people are having to travel really far away, and nobody, can retire there. Nobody can build a family there because if something goes wrong, there's no help that you can get. And so building back up our hospitals is so critical.
Go ahead. Absolutely critical. One one thing also to note, if the federal action is successful, but Tennessee refuses to expand, that means Tennessee's not getting those additional federal funds flowing into the state. The cost of Tennessee's refusal to expand coverage will continue to climb at the rate of $3.8 million per day. That's what we are missing out on by not expanding. So what we want to emphasize and what people really need to understand is that even if there's a federal coverage gap fix, Tennessee still could and should expand Medicaid. The federal government will always pay at least 90% of the cost. As Ella mentioned, there's some efforts to increase that matching rate in order to incentivize states, but the floor is 90%. So that's what we can count on for the expansion population. Also, Tennesseans would gain health coverage by the state expanding. Not only people in the coverage gap benefit, but people who have private insurance would benefit. And that's because it would shore up our healthcare infrastructure. Think about people who live in rural areas who do have health insurance. If the hospital closes, they also lose that access. So having the health insurance really doesn't get you that far if you don't have a place to go. So it's really important to not just think about the people who are in the coverage gap, but we're all connected. We're all part of this infrastructure that really needs to be invested in and taken into account long-term the impacts of closing that gap. Also, state officials have estimated that Medicaid expansion would have brought in $1.4 billion in federal funds. That's not even considering the ARPA incentives. Just straight Medicaid expansion without any additional incentives would bring in $1.4 billion into the state economy every year to support our healthcare infrastructure. I've seen previous estimates of 15,000 jobs could be created from this investment, not to mention providing health insurance to people so that they can be healthy enough to work and contribute to the economy. And so these are all factors that Tennessee cannot ignore. Again, just to paint the picture, Tennessee is losing money every day that we don't expand Medicaid. Over the last 7.25 years, we've lost over $10 billion by this refusal to expand. And then I saw a question from someone about ways to take action. How can we change the narrative and get our legislators to listen to us? I think there's strength in numbers. There's been a small but vocal group of people in Tennessee who've been advocating for Medicaid expansion for many, many years. But we need more people to be raising their voices about this. And so I've included here ways for people to take action. You can email, you can tweet, you can call, you can follow TJC on social media. We're on Facebook, Instagram, and Twitter, and you can share the posts that we put up about Medicaid expansion and all the reasons why the state should do it. We're also looking for people to tell their stories. If you're in the coverage gap and you want to share what it means for you or your family to not have access to health insurance, we definitely want to amplify those stories so we can put a face on this issue. Letters to the editors are helpful, and volunteering is helpful. So when you get a copy of these slides, you can check out this link, and you can also put the link in the chat for people who are joining us live, and you can pledge to take action and see how long it takes to do any of these things. And of course, TJC is available to help people to do any of these actions that they're interested in. And if you have ideas of other ways to take action, if you have a church group or a neighborhood group and you want someone to come and explain on a one-on-one level what this means and break things down in very understandable terms, we're willing to do that as well. So any ideas, any questions, we're always open to have those discussions and help people.
And Kanika, can I add a couple things to that list for people? Don't
Absolutely.
forget to call, don't forget to call your federal legislators. As we're mentioning, the federal government's, there's so much urgency right now. Reminding your state senators, calling your other, depending on where you are in Tennessee, calling your representative and letting them know on a federal level that this is something that you support. I think, at all levels of government, it's important. I've taken these calls myself from a congressional office, and these numbers matter. Maybe as each person calls, it really does make a difference. That number builds, and it can really change minds about where legislators are on a certain issue. And don't think your call doesn't matter. It really does. And just don't forget and encourage your friends to call, write postcards, write letters, whatever you can do, and talk to them. And also our office is available to help with explainers, whatever we can do.
Awesome. So again, if you have questions, please put them in the Q&A box. I'm going to check and see if there have been additional ones that we have not answered. So one person has asked, what are key stakeholders saying about expansion in Tennessee, such as the Tennessee Hospital Association, physicians, pharmacists, and the therapy organizations? That's a great question. I think everyone agrees that Medicaid expansion makes sense. Anyone who's in the healthcare industry understands, issues in terms of covering the cost to provide care and how it's important for people to have coverage in order to do that. In terms of formal statements, I think that some groups are a little more gun shy than others in terms of speaking out publicly, but overall, all healthcare providers are on the same page when it comes to Medicaid expansion. I think,
and I bring it up in all my meetings, and I ask them, and they are on board. Hearing from them and reminding them, I think they are a powerful voice. We saw when the block grant came up, they didn't even let any testimonies from hospitals or healthcare providers. But, I always encourage them to reach out because they're also constituents of the legislation or the legislators and the governor. So to keep pushing that. But they are in support. It makes complete sense from them to, get paid at the end of the day for the work that they're doing and keep their hospitals open.
sure.
And pharmacies as well. Medicaid has they cover, all prescription drugs and how to, so they're, it's helpful to them as well to help people get access to the medications they need.
Absolutely. And pharmacists are, oftentimes the first line of defense. People, go into the pharmacy and need to fill prescriptions. And sometimes they find out when they hear the total, they're like, oh, but I have insurance. And they're like, what? No, you no longer have insurance. You've been cut. We got a lot of messages from pharmacists when there was a redetermination and people who were on TennCare, thought that they were still covered and then they had been terminated. So pharmacists are definitely key to this discussion. And we know
And
that
also,
prescriptions are very expensive. You can't necessarily afford them without insurance.
and having pharmacists be able to do their job. And, as we were saying, they're kind of the first line of your interaction with a healthcare provider. And they want to do their jobs as pharmacists, but people are coming in and talking about being sick and because they can't go to a doctor, you know what I mean? And so being able to have people go to a regular primary care provider, or not just coming in when things are terrible, and having continuous access to care so things don't get terrible, or your pharmacist isn't the only person you have to call, even though they are great providers and would love to help you. But wanted to add that too.
Absolutely. One person has asked for an explanation of the difference between TennCare and Medicare. Absolutely, that's a very common question. So TennCare is what we call our Medicaid program. So Medicaid and Medicare are two different programs. They're both federal programs, but Medicaid is a federal-state partnership, and each state has the ability to run their program the way they want and to call their program what they want. And so just to keep people on their toes, Tennessee calls its Medicaid program TennCare. And that's for low income people who fit within certain eligibility categories. As I mentioned before, it's parents, children, older adults, people with disabilities, some women with breast or cervical cancer, and also former foster youth up until age 26. They qualify for Medicaid. And so again, Medicaid is known as TennCare here. Medicare is a separate program. The state doesn't have anything to do with Medicare. It's totally federally run, and it's for people who are 65 or older who paid into the Medicare system, and that's how they, can have their health care provided in their older years. So think of Medicare as a federal program and Medicaid or TennCare as a state-run program for low-income people.
Yeah, and I was just going to add in for reference, what Medicaid expansion would do is close that gap between, where TennCare ends and where Medicare begins to get those people that care until they're able to get on this federal program that we've created. So everybody under 65, so 64 to, down all the way until after their children, be able to get them that care, even if they aren't a pregnant woman or they're not in foster care, those different things, and close that gap for people who may not make enough or have an employer sponsored plan who are currently uninsured and don't qualify. And so all these other states, they all offer that coverage to this new group and bridge the gap.
Absolutely. Another question is, do we know if Representative Cohen
He is huge supporter, and we work closely with Cohen's office and could not do anything without them. And they're huge fans, and they're also co-sponsors of the bills that we're co-sponsoring in the House. And Warnock's bill has a House companion bill, and he's a co-sponsor of that too.
Great. So someone is interested in the contact for group meeting presentations. I will we'll put an email address in the chat, but you can feel free to email info@tnjustice.org if you're interested in that. But also my email address is displayed here, kyoung@tnjustice.org. So you can email us and we can work with you on setting up group presentations. Another question, what is required for counties to act on their own if federal legislation fails? Unfortunately,
oh, go ahead.
Oh, no, Ella, you can.
I didn't know if she was referring to the Cover Now Act, that new plan. It's a little complicated. They technically go through the states, but the states can't stop them, but they would have to build out their own provider networks and build their own programs and enroll people in coordination with the state, but they would work directly with CMS, which is the federal agency that runs Medicare and Medicaid. So they are the ones that work with states and in this case, counties. But that would have to be a decision there, and it's pretty complex, but happy to answer more questions, or Kanika, go ahead.
Yeah, I was thinking that the question is related to whether counties could do something without the federal legislation. And unfortunately, they would not be able to. The way that the Medicaid and Medicaid expansion is set up, it has to be a federal state partnership. Federal law indicates that the state has to designate its Medicaid agency, not the county. And so the state is the sole authority when it comes to Medicaid. The county would not have the ability to expand Medicaid or to do anything related to the Medicaid program without the involvement of the state. We still have a few more minutes. If anybody has any other questions, feel free to type them into the Q&A box and we will try to answer them. Ella, did you have anything else that you wanted to mention while we wait to see if there are more questions?
Well, I'm trying to think off the top of my head, and I didn't know if there were any questions on Facebook either. That is not Cover Plan Act with the one. Oh, that is called the Medicaid Saves Lives Act. That was the question. And that was introduced by Warnock and Boudreaux there. She's also from Georgia. She's a House representative. So it's the Medicaid Saves Lives Act. And that is likely the one to be included in any sort of federal legislation, because I think when we're looking at this federal plan, everyone really wants something to fully fix this coverage gap right away and get the most comprehensive plan that we can in this moment that we have. But happy to answer more questions on that.
Thank you so much. I'm seeing some more questions. I'm gonna put my email address in the chat. So if you are interested in getting connected or getting a presentation for your group, my email is kyoung@tnjustice.org. Also, the recording will be posted on TJC's YouTube page, and the slides will be emailed to everyone who registered along with the copy of the recording in case someone registered and wasn't able to attend. Let's see if there's anything else. We have the link in the chat to sign up for our next trainings. The next one will be a back to school vaccine info session. We're pleased to have two pediatricians, Dr. Dentz and Dr. Senard, presenting about immunizations and why it's important for kids to catch up on all of those missed immunization doses that occurred during the pandemic when people were sheltering at home. So we hope you'll register and tune in for that next session. And I'm not seeing any other questions. So I think that we can go ahead and close out. So thank you again, Ella Matthews. Oh, sorry, I see. Do you know how the Tennessee Senators feel about this proposed act?
I have not heard anything from them. I would encourage you to reach out to them and ask, and let them know how you feel about it and hear back from them, both at the state and federal level.
Absolutely. Definitely don't be shy about reaching out. These are your elected officials. You definitely can call them and ask them questions and actually help them understand what Tennesseans are experiencing, and sharing your perspective is really helpful to inform the decisions that they're making in DC on our behalf.
And
So
I would also, I know we're trying to close out. I was going to add something on that. There is some thought, from the way you look at these programs, to set up a new federal program for everyone and close the coverage gap all at once, either broad or narrow, however they decide to do it, would be more expensive to the federal government, and states expanding Medicaid. The money's already been paid for to these states to do that and set aside in the ACA and the American Rescue Plan. So it would actually cost less to the federal government if states would expand. So just something to note there when you reach out to your senators.
great note. If people have questions after we conclude, definitely feel free to reach out to us. You can email, or you can send us a note on social media. Again, Tennessee Justice Center is on Instagram, Facebook, and Twitter, and we love to hear from people and answer your questions. So don't be shy about reaching out. And thank you everyone for joining us today. Have a good day.